Hello, magandang araw! Sa video na to ay tatalakayin natin ang prenatal development. So, ang intended learning outcome natin ay to determine the influence of genetic processes in the development of children. So, let's start. The beginning of development happens upon conception. So, conception, yun yung union ng egg cell at ng sperm cell. Subsequent changes brought about by the development changes can be traced in this crucial period of life. Central in the understanding of prenatal development are changes brought about by the biological aspect. Genetic structures, hormonal activities, and physical readiness to pregnancy are directly affecting the development of a child, both in the period of pregnancy and after birth. These are critical factors as they can result to physical deformities, developmental delays, severe medical illness or condition, and even death when little attention are provided. So the prenatal stage is considered to be one of the shortest period of development, beginning from conception until birth, but also be the most crucial of all the stages since the child's survival depends highly on the mother's supportive behavior and attitude toward pregnancy. The child's stable development depends on the capacity of the external environment to provide one's need. So kung maaalala natin, once na ang isang babae ay buntis, isa na tong crucial na yugto ng kanyang buhay kasi yung bata sa sinapupunan niya or yung zygote, embryo, diyan na magsisimula yung kanyang pag-grow at yung kanyang habang siya'y lumalaki ay depende sa nanay niya kung anong kahihinatnan niya, no? Kaya minsan, no, pag ang isang ina halimbawa pabaya siya or hindi siya nag-take ng enough vitamins, hindi siya nagpapa-check up, nagkakaroon ng problema kagaya ng nabanggit kanina, yung mga physical deformities, yung mga developmental delays, or yung nagkakasakit ng mga ADHD at iba pa. At saka talaga may ibang sakit or mahina ang bata. Gayon din, ang nakakalungkot ay may mga bata talaga or mga baby na namamatay. Mahalaga rin na binibigyang konsiderasyon ang edad ng ina sa pagbubuntis. Kasi sabi nila, or sang-ayon din sa mga pag-aaral, no, ang may ideal na edad ng pagbubuntis o yun yung may range. Of course, no, mahalaga yung ang ina talaga, handa siya. Or yung kumbaga ang physical, mental, emotional, lahat na holistic nga. Dapat handa talaga. Pero isa sa ideal is yung middle 20s, late 20s hanggang early 30s. So yun daw yung period kung saan ang isang ina ay handa na rin sa kanyang handa na ang kanyang reproductive system. Gayon din, kapag ang isang ina ay hindi handa, doon nagkakaroon ng mga problema. So, kaya minsan, no, may mga bata na isinisilang na may kulang na bahagi ng katawan o may mental delays, ayan. So, move tayo sa the beginning of life. Depending on the menstrual cycle of a woman, a matured egg cell is released once a month by one of the ovaries that eventually enters in the fallopian tube. So this process is called ovulation. This is the signal of the readiness of a woman of becoming pregnant when a sperm cell has penetrated the ovulated egg cell. So kapag ang isang hinog na egg cell ay ayan, nalaglag or nag-enter siya sa fallopian tube, yan, go na yan. Ngayon, kung may makasalubong siyang sperm cell, ayan, malaki syempre yung chance na may mangyayaring fertilization. Pero kung hindi naman, ayan, eventually magiging dugo or menstruation. The union of egg cell and sperm cells is called fertilization, and the new cell becomes the zygote. One of the major activities in this period, aside from traveling to the uterus wall, the zygote form blastocyst. Primarily, its purpose is to become protective membrane to the developing cell. The prenatal stage typically covers 40 weeks or 280 days, including the additional 2 weeks to account for the last menstrual period and ovulation. Hence, the average human gestation is from 37 to 41 weeks. Infants that are born earlier than 37 weeks are considered preterm, while those that are born 42 weeks or more are called postterm. Both cases are threats to the child's survival, although recent developments in the use of technology in medical science has drastically increased the rate of survival. So, siguro kung nababalitaan natin, no, kapag ang isang bata o ang isang baby ay maagang lumabas o yung premature, usually nandun siya sa incubator, no? At kumbaga nagpapalakas pa. Minsan may mga pagkakataon na nagtatagal ng weeks or even months pag mahina yung bata. Gayon din naman, nagkakaproblema din kapag ang isang bata naman ay kumbaga na overdue or medyo napasarap sa pag-i-stay sa sa tiyan ni mommy, kasi usually ang nangyayari, nakakakain na ang bata ng dumi. So, parehong cases yon, yung pre and post term ay threat sa survival rate ng mga babies. The zygote is a combination of 23 chromosomes from each parent. These chromosomes contain genes that specifically carry characteristics of an individual. The process of natural selection determines the inherited characteristic of a child, such as physical attributes like color of the hair, eyes, height, complexity, or complexion, muscular build, cognitive functioning like intelligence, personality characteristics, or dispositional tendencies, health conditions kagaya ng heritable illness and diseases. O ikaw, maaalala mo ba ano yung mga characteristics na namana mo sa iyong parents? Kasi sabi nga, ang ating mga magulang or yung zygote ay kombinasyon ng 23 chromosomes na galing sa ating mga magulang. At yung mga genes na yon ay may dalang katangian. So siguro, maiisip mo kung ikaw ay kulot or ang nanay mo ay kulot or yung tatay mo ay kulot, isa yan sa naiipasa talaga. Kaya, or isa yan sa dominant characteristics. Kaya malamang, ikaw ay kulot din. Or sa mga lalaki naman, yung baldness, naiipasa din yan, or yung pagiging panot. Gayun din, yung mga sakit, kagaya ng cancer, ayan, hereditary yan. Ang diabetes, kung hindi ako nagkakamali, yung type 1 diabetes, kasi yung type 2 naman ay, it's a lifestyle disease. So, yung type 1, siya yung namamana or naiipasa. This set of genetic characteristics composing the zygote is called genotype. In the natural selection process, not all genetic characteristics become observable. So, may mga characteristics na hindi nakikita sa'yo, pero eventually, pag nagkaanak ka, pwede mo yang maipasa. Instead, some of those characteristics may either come out later in the adulthood development called maturation, or are not meant to be out at all. Hence, those characteristics become observable are called phenotype naman. So, the phenotypic characteristics are actually a result of an interaction of the individual's genotype and one's environment. Those characteristics that are not phenotypic remain dormant characteristics until such generation that it will come out. An example of these chromosomes are those that determine the sex of the zygote. So, alam nyo, no, maikwento ko lang, no, nung sinaunang panahon, akala ng mga tao ang nagde-determine ng sex ng baby ay babae. Parang nung sinauna nga ay mahalaga kasi na lalaki ang maisilang kasi 'di ba ang mga lalaki ginagamit 'yan or mga sundalo 'yan, ginagamit yang warrior. So tinitrain 'yan and usually ang mga babae pangbahay lang. Kaya may mga pelikula na ayan, pag ang isang ina ay hindi makaproduce ng lalaki, siya yung sinisisi, which is mali. Sa determination ng sex ng isang baby, ang dapat nating sisihin or ang nagde-determine yan ay ang ama. Kasi, yan, so discuss natin, no? The egg chromosomes always have an X or double X combination, which basically comes from the mother. The sperm, however, can either be X or Y, XY combination that comes from the father. When the X of the mother is combined with the Y of the father, it is expected that the sex of a child is male. Following the same cycle, men do not lose the X chromosome, which makes him later on capable of having a female child. This is the same principle that happens in the other heritable characteristics like diabetes. It is possible that there could be generation gaps in the occurrence of diabetes as it may become phenotypic characteristics, or there is a weak push for the environment for it to become observed. If this is inherited or the genotype, it can still be passed on to the other generations later on. So again, no, ang mga lalaki yung nagde-determine ng sex ng isang baby. So dito sa illustration natin, no, ang mother kasi wala siyang choice. Double X lang talaga yung lagi niyang dala. Pero si father or si tatay ang dala niyang sperm. So pwedeng double X i-minix sa double X, so girl yon. And XY naman, so magiging lalaki yon. So let's move on to the stages of prenatal development. The development that occurs all throughout the prenatal are divided into three substages of development. These are the germinal stage from fertilization to 2 weeks, embryonic stage 2 weeks to 8 weeks, and fetal stage from 8 weeks to birth. And these stages have distinct activities, most especially in the physical development of the organism. So let's start with the germinal stage. In approximately 3 to 4 days, the zygote travels along the fallopian tube and eventually implant itself to the uterus wall. The mitosis or yung tinatawag na cell division permits the development of blastocyst. Aside from protective function, it serves at this stage. It is also the source in the development of the amniotic sac, placenta, and umbilical cord. Next is the embryonic stage. The significant development in this stage is the formation of major organs that form the biological systems such as respiratory, digestive, and nervous systems. Both the end of the 8th week, limbs can be identified already that would appear like a underdeveloped fetus. This rapid development of the organ is also accompanied by more risk of spontaneous abortion or miscarriage, most specifically during the first trimester, meaning the first 3 months. In the whole period of pregnancy, this is considered as the most crucial. It develops in an intrauterine cavity through the amniotic sac composing the amniotic fluid. This results to the development of the umbilical cord and the placenta, which supply the nutrients and other hormones that are necessary during pregnancy. The last is the fetal stage, considered the longest and the final stage of pregnancy, lasting until giving birth. Aside from having all organs to be highly developing, senses are becoming more functional, such as fetus being able to respond to the heartbeat and voice of the mother, while sense of olfaction develops at 14th week. Locomotion can be felt also by the mother, most especially when the fetus is stimulated. Fetus also manifests certain degree of memories, especially on the voice of the mother. Now let's go to the factors affecting prenatal development. First is the threats or are the threats to prenatal. Considering the delicate condition during pregnancy, there could be some threats to a successful pregnancy. One is miscarriage. This happens when a baby is lost before the 20th week of gestation. Beyond this, it is already considered as stillbirth. There are several reasons why pregnant women will experience miscarriage, but the most common reason for such is chromosomal abnormalities. Aside from this factor, the other factors are discussed or we will discuss on the other videos. Next is ectopic pregnancy. While it is expected that the zygote will implant itself in the uterus, there could be instances where it is implanted along the fallopian tube or elsewhere outside the uterus. Ito yung minsan sa biruan, no? Ito yung ang baby daw or yung zygote naliligaw kasi kung saan-saan daw siya nagpupunta. Hindi naman daw dapat siya lumabas. Okay. Ayan. Since it is not designed to grow a zygote, it is rather detrimental to have a successful pregnancy. The American Pregnancy Association has identified 4 possible medical reasons for an ectopic pregnancy. There are infection or inflammation of the fallopian tube, scar tissue from the previous infection or surgery, previous surgery in the pelvic area, and abnormality in the tube's shape. Without prior medical examination, this can happen without noticing it. Number 3 is complication associated to pregnancy. Upon gestation, hormonal and biological changes are expected rapidly. This may cause medical-related complications that can cause loss of pregnancy. Some of them are gestational diabetes, sudden imbalance of the sugar level. So sabi nila, mostly daw ang mga buntis, prone talaga yan sa gestational diabetes. Kumbaga madaling tumaas ang kanilang blood sugar level. At isa pa, mas prone sila kasi mapapansin natin lagi silang ihi ng ihi. Ayan. At maibigin sila, no? Depende sa buntis, no? May buntis na mahilig talaga siya sa sweets. So, kaya ang nangyayari, lalong malaki yung chance na magkaroon ng diabetes or sudden imbalance ng sugar level. So, aside from the gestational diabetes, meron din tinatawag tayong pre-eclampsia and infections. Yung pre-eclampsia, yun yung high blood pressure. Kaya medyo nakakatakot yung pre-eclampsia kasi ayan, may mga mother talaga na bigla na lang namamatay. So when are not treated medically, this can cause fatality. Next is bleeding or spotting. This is the blood discharge while on gestation, most specifically during the first trimester. The danger of bleeding depends on the frequency as well as the amount of bleeding. One of the primary reasons on the occurrence of bleeding is the implantation process. When the amount of bleeding is extraordinarily plenty, this is something that should be reported immediately to the medical doctor as it may signal irregularities to the development of the baby. Now, let's discuss the factors affecting pregnancy. There are a number of factors that affect comfortable or complicated pregnancy as well as on the development of the baby. So we will discuss the factors that can contribute to the easiness or difficulty of pregnancy and the child's development. First, maternal context. The characteristics and readiness of the mother's biological system can greatly affect the quality of development that will take place. So, ito yung na-discuss ko kanina sa simula ng video natin, no? Laki yung naiitulong talaga ng biological system mismo ng ina para sa mas magandang development ng baby. So, since the zygote will collect nutrients from the mother's body, it is important that the mother is ready to provide what the zygote needs to achieve stable development. As such, underweight mothers usually have dangerously smaller babies compared to those with average weight. So kasi syempre si baby, kumukuha siya ng mga nutrients. Ang problema pag ang nanay ay underweight, lalo siyang mababawasan ng timbang at mauubusan ng mga sustansya sa katawan, no? Mahalaga si nanay or si mother ay healthy upon pregnancy, no? It is important for the mother to make the necessary adjustments in food intake in order to address feeding demands of the baby. This adjustment requires special attention since going overweight may result naman to other complications. Aside from nutritional concern, it is necessary that the mother is able to provide the needed vitamins and nutrients such as folic acid that will facilitate better development. So, ang ipinapayo pa nga bago magbuntis, kailangan uminom na ng folic acid kasi ang folic acid nakakatulong yan sa development ng brain ng baby. So, natatandaan ko nung ako'y nagbubuntis, ayan, lagi akong umiinom nitong folic acid. So, in addition to the factor is the age of the mother during pregnancy. So, nabanggit din natin yan kanina. Pag sobrang bata, maaari ding may epekto. At ganun din pag sobra namang tanda or yung nakaka-produce na ng mga menopausal babies. Although full sexual maturity is achieved during adolescence, women's body is still considered premature in terms of pregnancy. The amount of physical activities the mother may engage in also affect the pregnancy. Many birth defects are actually associated to the maternal context factor. So, yan, nabanggit din yung mga physical activities. Sabi kasi ng mga matatanda, kapag ikaw ay nagbubuntis, hindi kailangang paupo-upo ka. Hindi kailangang patulog-tulog ka. Ayan. Kapag ikaw ay nagbubuntis, kailangan ikaw ay lumalakad din, may exercise. Hindi naman yung exercise na heavy. May mga exercise designed para sa mga buntis. Kagaya lang ng simpleng walking, 'di ba? Madalas makakita tayo ng mga buntis na naglalakad. Pero syempre depende 'yan. May mga buntis kasi na yung kapit ng kanilang mga babies ay hindi ganong kahigpit. Yan. Kaya hindi sila pwede sa mga physical activities kagaya ng walking. Pero generally, ang isang healthy na nanay or nagbubuntis, pinapayo yan na at least maglakad-lakad or gumalaw-galaw. At sabi nga na matatanda, huwag patulog-tulog. Next, let us discuss the medical-related concern. The kinds of medication the mother has taken before and during pregnancy can possibly cause deformities, delayed development, and fatality. Among these medications are those described to be antidepressants, which may cause an interruption to the neurobiological activity and respiratory failure. Possible miscarriage can be the effect when drugs that are primarily being used to treat cancer and complication of leprosy are taken. Common among young parents are the consumption of alcohol, which is common cause of mental retardation, birth defects, disorders in the central nervous system, and many learning disabilities. Equally accessible to many young adults is cigarettes, which contain nicotine. Like the effects of alcohol, nicotine has many negative effects to the child during pregnancy, such as increased probability to miscarriage and stillbirth, mental retardation, neurobiological and cognitive related disorders, reproductive problems, especially to boys, and other school related problems like hyperactivity, learning problems, show attention span, low IQ score, and among others. Other drugs that may affect baby's development are caffeine, marijuana, and cocaine. The current medical procedure and equipment are still not sufficient to fully account the extent of their effects. So, yan, maipapayo nga na ang isang nagbubuntis ay syempre iwasan yung pag-inom ng alak, yung mga may caffeine. Actually nga pinagbabawal, ideally, maganda sanang hindi uminom ng mga soft drinks kasi yung mga soft drinks, yung iba doon may caffeine and ganun din masyadong matamis or yung sugar content sobrang sobrang taas. Okay, gayon din yung mga iniinom na gamot. Ang mga buntis din ay prone din yan sa UTI. Kaya may mga pagkakataon na may pag malala yung UTI, nilalagnat, nagchichill. So, kailangan ng isang buntis maingat din kasi pag nagka-UTI siya, pag malala yung UTI, pwede siyang makunan. Next ay environmental factors. The amount of social support provided by the immediate environment can affect the quality of pregnancy experienced by the mother. This environmental support that strongly stimulates the release of hormones responsible for the positive emotion. And the last, other factors. Equally important is the quality of sperm that comes from the father. The genetic makeup that is shared by the father may result to deterioration, physical and cognitive functioning of the child. Color blindness, for instance, is inherited exclusively from the genetic makeup of father and is common among male. This condition is associated with the Y chromosome. So, ibig sabihin yung color blindness, ayan, at saka yung baldness, yan ay naiipasa or naiipamana pala. Ayan. Okay. So, those are the factors affecting pregnancy. And here is our reference, Child and Adolescent Learners and Learning Principles. Thank you for watching, and ganbate kudasai, always do your best.